My name is John Hare, and today I want to talk about the newest drug fad. As a matter of fact, it's been around for a little while. It's basically a drug called semaglutide, but you'll be probably more familiar with the word Ozempic or Wegovy. And what they are an injectable, once-a-week injectable treatment that basically what it does is it slows down your digestive process to the point where you feel satiated. In other words, when you eat, you don't need to eat more. And apparently it works quite well. In other words, you can lose weight with it. Trouble is you're injecting yourself every single week. And you can't stop. By the way, if you stop, you apparently gain all the weight back. And so that's, plus it has a multitude of side effects. As a matter of fact, that's the most interesting thing. But really what I want to talk about more than anything else is, okay, so now we've all of a sudden found, and by the way, the maker of this drug, Ozempic and Wegovy, a company called Novo Nordisk out of Denmark, they have now, because of this drug alone, and they can't meet demand at all, become the biggest company in Europe. As a matter of fact, the company the company valuation is bigger than the valuation of the country of Denmark. So, I mean, Denmark's not that big, but it's big enough, to the point where that company has done so well based on this one drug. And really, it's a weight loss drug. And I'm not saying that weight is an easy thing to lose. I've been fortunate in my life. I've basically, since I've been a grown man, I've been about 185 pounds and varied maybe 2 to 3 pounds throughout that time. So, I'm certainly not one to talk about trying to worry about losing or gaining weight. Probably more than anything else, because of what I play, I wouldn't mind gaining a few pounds, but regardless. But now we've got this drug that it's become a fad drug. As a matter of fact, it's not just it's originally licensed. The Ozempic is actually licensed as a treatment for diabetes. Wegovy is just a higher dose of the same product, semaglutide, and it's been licensed for people who are obese. Both of them, at least especially the one for Wegovy, is that you combine it with exercise and diet. So in other words, it's not just the drug itself. You have to do things otherwise to make it work, and I guess that gives them an out if it doesn't work for you. You didn't exercise enough, or you didn't eat the right food. Anyway, those two things, if you stop and think about it, probably have a lot to do why the person might be obese to begin with. But there might be other reasons as well. And so, in other words, and there's lots of people who say this, I hear it all the time. I can't lose weight no matter what. I exercise, I diet, I do all those things and it doesn't work. Well, you ever stop to think maybe there's something in your gut that might be causing that problem? One of the things that my company has done is we do what we call a microbiome therapy. And right now, microbiome therapy is big talk as well. As a matter of fact, they've now determined through all kinds of research, I think 10,000 research papers a year dealing with the bugs in the gut and how they affect your health, and so they've really now determined that almost more than anything else, those bugs can dictate to how you are going to live the rest of your life. And so the balance of those bugs is very important. And so we don't know, there's let's say roughly 1,000 species of different bugs and up to 100 trillion of them in total. To try to figure out the permutations and combinations of which ones work together and are causing you to be obese or causing asthma or whatever they are, we don't know. But one thing we do know is that you can target certain bugs in the gut to as a matter of fact, mostly people, what they say about targeting is they're thinking about a probiotic, adding good bugs to maybe those are the ones you need to not be fat anymore. Alternatively, you could have an antibiotic, which unfortunately isn't targeted. It'll knock out all the bugs in your gut. And we're very familiar with that because we actually have a phase 2 clinical trial right now ongoing for a treatment against Clostridioides difficile, or C. diff for short. C. diff is a gut bacteria that proliferates after you've had a general antibiotic treatment. So in other words, you're in the hospital, you get a knee surgery, and they give you an antibiotic, general broad-spectrum antibiotic, to prevent you from getting an infection in your knee. Meantime, that antibiotic knocks out the gut flora in your gut, which now makes you susceptible to C. difficile, which unfortunately proliferates in hospitals. So that's a great place to get sick with C. diff. And there's about 500,000 cases a year of C. difficile infection in hospitals. It's now the biggest hospital-acquired infection in North America. And the only reason I'm talking about that is that we know that by targeting bugs in your gut, it'll influence your health. And we have a treatment right now that's working very well, going through phase 2 clinical trial for C. difficile infection that directly targets that bacteria and its associated problems. So now, what about if you could take a different type of antibody, and actually these are oral dose antibodies, you basically just ingest them and they go and they knock out certain bugs that are causing problems, like in the case of C. difficile. What if you could target something that's causing obesity? Okay, so now you're actually going after the problem, which unfortunately all these drugs like the Wegovy and the Ozempic and those other ones, and there's other ones coming up. Eli Lilly has just come out with a new drug that's going to apparently be better than both of those. And their stock price is going up. But again, none of them are trying to solve the problem as to why you're overweight. What if we could come up with something, and we're not saying we have it, but we've seen it, by the way, with a few of our antibodies that we've got, that would actually target the bugs in your gut that are causing you to not digest. Or secondly, and one of the things that could be, and by the way, my background is animal agriculture. Our same treatments, we actually have registered the world's first oral dose antibody to treat E. coli in baby pigs. And we know from, and you can do experiments with animals a lot easier than you can do with humans. We know that if baby pigs have got an infestation of E. coli beyond a certain amount, and all animals and humans have E. coli in their gut, no question, but when it gets to a point where it's chronic, what E. coli does in baby pigs, in your small intestine, you've got things called villi, which are like little fingers that stick out from the wall of your intestine that add to the absorptive capacity of the food going through your intestine. You need it, it gets broken down in your stomach, and now it's being further broken down, and it needs the nutrients in that need to be ingested into your system to give you the nutrients you need. Well, if you've got an E. coli infection, for example, that's beyond the standard levels of E. coli that most people would have, we know for a fact in baby pigs that the villi, those little fingers that are supposed to add to your absorptive capacity to help you absorb nutrients, they actually shrink. They're literally to the point of going away. So now you think about it, your absorptive capacity, think about what potentially could be causing you to get heavy. You have to eat more to get the nutrients you require, but you haven't got the absorptive capacity. So maybe it could be something just as simple as an antibody against E. coli being fed on a daily basis to eliminate that bacteria. Now your villi grow again to the point where you're getting the absorptive capacity you need. The nutrients you're getting are naturally getting into your system as they should, to the point where you don't need to overeat to get what you need. The other problem with your gut microbiome, the bugs in your gut, is that certain bugs will proliferate, grow based on what you're eating. So, I'm going to tell you, you could take an E. coli antibody, but at the same time, you probably should cut down on sweets. Don't drink pop, Cokes. People don't understand the amount of sugar in one soft drink is between 40 and 50 grams. And I hate to tell you how many, I think that's 14 or 15 sugar cubes every time you drink one Coke. And then the other side is, get some fiber, because fiber is a good thing to help you with digestion. So, it's just like with the Ozempic and the Wegovy, when they tell you you've got to get exercise and eat a correct diet to make sure that they're injectable weekly treatment, which, by the way, costs about $1,500 per month. Okay, so think about what that cost is. You've got to do other things to make things work. But what happens when you eat a lot of sugar, for example, the bugs that like sugar proliferate in your gut because you're feeding them, and all of a sudden they take over and they become the big guys on the block in your gut microbiome. And guess what they tell you? We want more sugar. And so they're literally telling you. So you think you get cravings for sugar, you get a sweet craving. Well, the reason you get it, because you've been feeding the bugs that have grown and now proliferated to the point where they need more. So you've got to break the system. So you break the system by cutting back on the sweets, for sure, you got to do that. But at the same time, if you can make it to the point where when you are eating, your absorptive capacity is increased because maybe you're getting rid of that E. coli problem, which, by the way, we have an antibody against. Anyway, check out Freedom Pharma. That's pharma with an F.com, freedompharma.com, and you might see some things that are kind of interesting, and there's actually a treatment there that might help on your weight situation, which certainly won't cost you, if it cost you $1,000 a year, would be, almost overdoing it, let alone $1,500 a month. Anyway, thanks for listening. Stay healthy.